Optum, in association with CNBC-TV18, launched the Health X Conversations with the aim to build a world where technology makes healthcare smarter, faster, and accessible to everyone. The initiative reached out to some of India's top educational institutions to spark fresh ideas and meaningful discussions. The session at IIM Lucknow gave a chance to students to engage with Kanika Agarwal, co-founder of MindPeers and a trailblazer in making mental health care accessible through technology. From tackling real-world challenges to exploring groundbreaking innovations, this session was a call to action for young minds to step up and shape the future of the healthcare sector.
Good evening, everyone. A very warm welcome to all of you to Optum presents CNBC-TV18 Health X Conversations. We are looking at a platform which is designed to spark meaningful dialogues, driving actionable solutions for a more inclusive, smarter healthcare ecosystem.
We're first company was bootstrapped. I loved the independence that I had to grow the company, the first one. The second one, I wanted to get the taste of how to raise investor money. So it became investor funded. We have done 3 rounds until now. And the second round, we were part of Shark Tank last year. And I think this was the very first time that mental health was spoken about on a mainstream TV in our country. Our team was prepared because Shark Tank distribution and all of those things. But when our episode aired, in literally 5 to 6 minutes, we had some 3.8 crore people who logged in, out of which about 90 lakh people ended up putting their problems, trying to book, trying to send us messages to say that, you know what, I also go through it.
Technology obviously can play a part, but how much do you think the split would be between technology and the implementation? Let's say ground level workers, ASHA workers, volunteers would actually help in implementing those technologies. So what do you think can be the scalability for startups in terms of technology and the implementation?
Yeah,
Great question.
Yeah, so I think two-pronged thing over here. First, I want to tell you that the problem in our country today is that we do not have enough psychologists, professionals to be able to cater to the entire population. So at ground levels, we are adopting the model which WHO came up with, which is called community gatekeepers. So which basically means going down and, let's say, recognizing a couple of people, making them aware that what are the symptoms of mental health issues, how do they look like, and what should you do when you see that someone is going through it? What should you say to them? How should you react? You were also talking about the caregiving element. So now there are a lot of these trainings that are becoming very popular, where we know that a psychiatrist or a clinical psychologist cannot be available for the entire population.
Definitely, I'd say that it offers the opportunity to create some social impact. So I would say that yes, after today's session, I am inspired to pursue a career in the healthcare.
Ambitions are important, so is the health. So I would like to balance both ambitions and as well as health. So that's the one major thing I would do. And yes, to answer your question, I would love to get into this sector.
I feel that overall the baseline awareness was there, but when listening to a personal story and seeing that she's doing such an incredible work, certainly made that whole thing much more profound for me.